Hello, my fellow classmates and other students of medicine. Today we're going to be reviewing Dupuytren's Contracture. What the condition is, its associated symptoms, both the epidemiology and etiology of this condition, tests for understanding and confirming its existence, and lastly, what treatments are available for it. I look forward to sharing this presentation with you, so let's dive right in. Dupuytren's Contracture. But what is it? It is defined as a fibroproliferative condition where the body overdeposits collagen in the underlying fibrous tissue in the palmar aspect of the hand. Now, this overproduction of collagen causes one or more fingers to curl or contract. The most common affected fingers are the third, fourth, and fifth metacarpophalangeal and proximal interphalangeal joints. The primary structures involved are the palmar aponeurosis, the Cleveland ligament, and the retrovascular cord known as the thomine. When collagen deposits become large enough, the pretendinous bands will pull the digits toward their connected palmar fascia. Symptoms for Dupuytren's contracture include inability to straighten one's fingers, reduced grip strength, nodules or fibrous cords on the palm, limited mobility, and depression. All these symptoms can be very problematic for a person when they have to adapt to new changes in their everyday lifestyle. As we all know from injuries, when we lose the ability to do something or adapt, we get depressed. This is a psycho-emotional symptom that is not widely talked about with this condition. The epidemiology of this condition is most common among Northern Europeans or people of Scandinavian descent. It is disproportionately seen in men. Very rare in people of African or Asian descent. And because of this genetic commonality, this condition was also known as Viking's hands or Viking's disease. The etiology is not well understood. Heredity definitely plays a huge role in its development, but there are some risk factors. Smoking cigarettes and drinking alcohol are probably the biggest. People with diabetes mellitus type 1 have a 3.06 times more likelihood to develop it. And of course, the microtrauma theory, which means that trauma occurs when the body sends an inflammatory response for healing, but those signals never stop, and there's an overproduction of collagenous material, therefore causing the nodules and cords and the contracture. Testing for this condition could be done by an orthopedist using the Houston tabletop test. The procedure would be to have the client standing next to a table with their hand outstretched on its surface. The patient would then lean in and put some pressure on the hand. If any of the fingers could not lay flat or looked contrasted, that would be a positive test. This test does have limited accuracy, as early stages of this condition will not indicate a positive test. The other methodology for diagnosing this could be self-diagnosis if visual impairment or obvious nodules were apparent. The most common treatment for Dupuytren's is called collagenase. It is an enzyme-based injection therapy that breaks down the peptide bonds of the collagen cords. This is the most non-surgical treatment, but has limited long-lasting results, with most results only lasting a year to 5 years. And hand therapists must manipulate the fingers to further loosen the fibers during the treatment and for multiple days after. In rare cases, the other option for treatment is an open surgery or fasciectomy. This method is usually indicated for severe cases when other non-surgical options have not worked. The cons is you're getting sliced, and as you can see by this photo, he barely has a hand left. And now for the moment we've all been waiting for: needle fasciotomy and acupuncture. Now, needle fasciotomy is more of a Western dry needle approach. Although it does have extreme effectiveness equally to collagenase injections, It definitely has a Western feel to it. So in acupuncture, we use filiform needles, but in this procedure, they use hypodermic needles. And what they do is they press it into the tendon or the aponeurosis most that's most inflamed. As you can see by this picture, there's dots everywhere, and they use the needle manipulating it to pry apart the cords and the structures. So this is a great treatment, and I'm sure it has um, great effectiveness, but it does have a higher risk of tendon and neuromuscular injury, which is not what we're looking for in a bigger hypodermic needle than a smaller filiform. Now, in acupuncture, we see things a little bit differently. From a TCM standpoint, it sees this complication of the tendons to be a result of a liver pathology or qi and blood stagnation in the channel of Han Tai Yang, Han Shao Yang, Han Shao Yin, and Han Jue Yin. So, because it's a liver pathology or it's qi and blood stagnation, we can either smooth the liver and or resolve stagnation in the channel. Electroacupuncture is very effective for this because it's going to really help activate the channel and the healing process and the breakdown of the tissues. So oftentimes in some studies that I read is that they would go to the extensor digitorum and the extensor carpi ulnaris and use those with two prongs and low hertz. I think 2 hertz was around it. The case studies and their results show really promising results, and people were able to regain some structure, mobility, and improved quality of life. So, alongside all the other research and articles I was able to find on Dupuytrens, the next set is really special because it's done by our very own Dr. Takada and then student, but now doctor, Eric Michelson. And what's really cool about this was done actually in the Southwest Acupuncture Clinic. And both these gentlemen were really, really nice to send me the paper they wrote. The woman had come in for chronic pain. And after the second treatment, they noticed that her fifth metacarpal phalangeal and distal phalangeal joints were completely contracted all the way to the palm. When they questioned her about this, she said, "Oh, I had been diagnosed with Dupuytren's, and it didn't seem to bother her like it did her other symptoms, but why not treat the root and see what we can do?" So what they found when they were doing meridian therapy is that the best form of treatment was to utilize the Shigo clock opposite relationships, and these happen to be extremely essential in altering the development of her condition. So what they did is they put some rice grain moxa on 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 the tendon, as well as did some small intestine points and some other liver points. Because what they found was that small intestine was excess and its clock opposite liver was deficient. So they were able to treat the root and they were able to bring a little bit of mobility to her, which was very nice. And I mean, the best thing is that her sleep and all these other symptoms that she came in for got better as well. But after a serious discussion with Dr. Michelson, I found, and he brought it to my attention that there's limits to treating this disorder because of the stage it's in. So the patient was completely contracted, which is like an advanced stage of this condition. So the best thing we can do is find this at an early stage and then really manipulate it to get it to be able to be flat on the table in a Houston's uh, tabletop exam and have more mobility, grip strength, all the good stuff. But at some point when it's at too far of a stage, there's going to be very little resolution and reoccurrence of symptoms are going to be much higher. Now, one last thing I want to share for this presentation is I want everyone to remember that there is no Eastern or Western medicine. There's only medicine. So we have to work together and discover what works best for every single patient, because not all of them are the same and not all of them are going to respond the same. It's a specialized medicine. It's only one medicine. I want to say thank you to all the viewers and my classmates for sharing this experience with me. I hope you're able to take some valuable takeaways of this condition. Thank you so much, and I hope this was very valuable for you. Have a good day. Bye bye.